Hi everyone, Nicola here from City Physio. So I thought I would just run you through what actually happens in our clinic when we do a TMJ appointment. Now TMJ is a really niche area of treatment and assessment in the physio world, and requires a physiotherapist to have additional training on top of their university degree to be able to assess and treat well the jaw. So your TMJ stands for temporomandibular joint, so basically your jaw joint itself. The most common presentations that I see in here are patients who describe tightness through the face, clicking, crunching and grinding. And most recently, with the last couple of years of the pandemic, we've seen a huge upswing in what I refer to as the COVID clenches. So people who have always been clenching or grinding, and then now it's just sort of leveled up. And it's now causing some quite significant wear on their teeth. They're cracking their teeth. They're getting pain with opening. They may not be able to open their mouth quite so far. And the pain sort of radiates down sort of along the jawline. People often describe things like clicking, catching, locking of the jaw, tightness, stiffness, particularly in the mornings after sort of a night of clenching or grinding, or even sharp pain, locking of the mouth open or closed. Things like that are typically the most common presentations. Now, a TMJ appointment is a little bit longer than most other appointments because we do a comprehensive assessment of the body. So about 80% of the inputs into the jaw itself are not from the jaw. So we're looking at your upper back, your rib cage, the way your shoulders move, your neck, your head, the referrals from specific joints of your upper neck, in your rib cage and in your spine itself. We're looking at muscle bulk, both of your sort of upper back, shoulders, postural muscles, as well as of the face. So when I look at a patient who comes in the door, the very, very first thing I look at is their posture. You won't even know that I'm doing that, but I've just kind of made a quick up and down at you in the waiting room, and then when you come in. The second thing is how they hold their body. So do they talk with their head on a bit of an angle? Do they sort of rub at one side? Do they sort of sit with a forward head posture? So, you know, sort of pigeon sort of head position there. Those are the big things I look at first. And now the second and sort of third and fourth things I go to from there are zoning back in on the neck and the face itself. So at a quick sort of scan through, I'm looking at the muscle bulk, particularly of the extensors of the back of the neck and of the face. So I'm looking at symmetry of the face. Does the jaw open symmetrically when they're sort of talking to me? What's the muscle bulk like in sort of this area? And then in this area, and then sort of in through the neck itself. And then do they have any moments where they clap, catch or unlock their jaw? So that's what sort of happens at a sort of a quick glance over. I'll ask you really specific questions around your jaw. How long has it been around for? Have you had any orthodontic work, teeth removal? Do you wear a splint? Have you got any cavities or tooth pain or anything you haven't had addressed? Do your teeth connect when you close them together? Do they touch, you know, at the front and the back equally? Is one side more in contact than the other? We'll ask you questions around headaches. Do you get headaches often? Do you get migraines? Do you get any referral into your arms, pins and needles, numbness? Do you have any problems with your tongue movements? Do you get any sort of sinus pressure or teeth that have moved more recently? You notice that they're crossing or doing something differently. And then we go into the actual face assessment part. Now, this is the different part for a lot of patients, is that we're looking specifically at the face. So what I do personally is I lie you flat on your back and I look at you sort of across the top from your forehead down, so from behind you. And that way I can see all of the curvature of your face and check for symmetry. And I can talk to you and get you to open and close your mouth, and I get a really exaggerated view of what's happening with your mouth. I then can measure things like your maximal mouth opening. Now, this needs to be measured because if you don't measure it, you don't know if you're improving. And I use this guy, which is a little scale that you basically hook onto your teeth at the bottom, and then you open. So you go, and then we look at the number that you've got there. We can also record side to side movement, protraction and retraction. So under like a bulldog and back sort of into retraction. And we'll measure that with this guy. We'll look at the strength of the muscles around your face. So we'll look at buccinator, which does this. We'll look at your sort of clenching strength. We'll look at the bulk around your neck. We'll have a feel through your neck with our hands, and we can tell sort of muscle bulk from that. I then may stick my hands inside your mouth. So what we'll do to get into sort of the muscles on the inside of the face, I'll often put a gloved finger inside and have a feel through the muscles on the inside through here. I may even put my fingers in your ears. So your joint of your jaw sits right up here. So sometimes it's easy to treat it from inside the ear. Sometimes it's easy from the outside. Sometimes it's easy from the inside of your mouth. So we'll have a sort of a feel and go through those positions. So that's basically what a TMJ appointment looks like. Now, based on what we do for your assessment, will dictate how we treat you and what the sort of the pattern looks like from that. So for most patients, I will typically be giving them an unloading exercise. So whether that be a massage, a trigger point ball, a particular stretch, and that's usually to get them some pain relief in the really short term. So I like to break my goals for treatment into 3. So the first one is, why are they here? Is it that they can't open their mouth, or they've got muscle tightness? So we'll give an unloading exercise to try and rectify that goal. And then our middle and long-term goals are more about working out the dysfunction and then preventing it in the long run. So if it's come from a postural issue or a grinding issue or stress management, we'll be looking to put those things in place in subsequent treatments to get you out of here in the long run. Our goal is to get you self-managing so that you can manage your jaw and prevent and treat when you do have flare-ups. The average course of treatment at our clinic is somewhere in the ballpark of 3 to 4 months-ish to about 8 months. Now, that often will have something along the lines of 6 to 8 treatments for the average patient. Couple close together to unload, and then sort of staggering them further and further apart so we can implement exercises and stretches and jaw movement changes and a few things like that. And we'll monitor your progress sort of after the first 3 or 4 close together. They might be 4 weeks, and then there might be 6, 8, and then the last one might even be 6 months later or 4 months later, to really make sure that you have implemented those changes so we're getting a sustained benefit down the track. If you guys have any questions or jaw issues that you would like to discuss, I am not able to do that via YouTube comments. So I can only do that via telehealth if you don't live in Sydney, or you can pop into the clinic and we can go through things very specific to you. So I hope that that was a little bit helpful for you on how a TMJ appointment runs with me. Bye.